Emotional overeating is a mental disorder characterized by a persistent habit of using food as an anti-anxiety tool. Eating, a state when the desire to eat does not arise at the level of physiology, ordinary hunger, but at the level of an unconscious desire not to feel emotional pain. From the point of view of my patients, overeating is a pain in the stomach. It is a feeling of distension and heaviness. It is a feeling of guilt caused by breaking promises made to oneself. It is a constant fear of starting to eat and not stopping. Overeating is a feeling of anxiety. Anger before the breakdown, and guilt and decay after. It is a constant feeling of losing food in the struggle for self-respect and respect from others. The usual history of patients is as follows. A person lived, worked, and engaged in everyday cares, and at some point during an appointment with a doctor receives information about his excess weight, which the doctor says not as an evaluative human judgment, but as a medical conclusion. Body mass index, more 27. Often before the application, a person does not consider weight as a problem. She is advised to monitor the quantity and quality of food, but when trying to implement this recommendation, a person faces his own powerlessness before the desire to eat. There are hormones that are synthesized in response to the food we eat. For example, the hormone of the pancreas is insulin. Each product has its own insulin index, that is, the degree of increase in the level of insulin in response to it. If a person overeats, a large amount of glucose enters the body at once, and accordingly, a large insulin response occurs. And insulin is the hormone responsible for delivering glucose to cells. When the cells have enough glucose and do not accept it, it begins to be deposited as a reserve in the form of adipose tissue. If the supply of glucose does not stop, the fat depots are filled. Then the cells are additionally protected from sugar by insulin resistance. They become insensitive to insulin, which creates a pathological chain of increased glucose in the blood, the impossibility of it getting into the cell, starvation of the cell, a signal about hunger, eating behavior, an increase in glucose in the blood, and fat in fat depots. Thus, pathological physiological hunger is added to psychological hunger. A genetic factor can also lead to such a condition. One of them is overeating. When overweight is determined, the diagnosis begins with the exclusion of hormonal diseases. A consultation with a psychiatrist is prescribed, who determines that the reason for gaining body weight is the body's defense mechanism against stress, anxiety, tension, disappointment, sadness and longing, which get stuck, relieve pain. How to recognize emotional overeating. The amount of food significantly exceeds the physiological need for weight, age, sex, and physical and emotional stress. It is better to do this according to the appropriate formulas or by contacting a family doctor or nutritionist. There is a connection with the emotional state, not necessarily external stressful circumstances, when a person understands that overeating is preceded by a strong emotion, which later weakens. There are no other somatic causes of overeating. There is no previous history of food restriction. The most frequent emotional causes of overeating can be such psychological experiences as sensitivity to criticism, experience of humiliation, the need for protection, suppressed anger, dissatisfaction with oneself, self-criticism, denial of one's feelings and oneself. What is the way out? To stop eating. This is often how people understand the coping strategy. Of course not, because food is a natural anti-anxiety agent for such people. Stop worrying? No, because anxiety is a normal, healthy reaction that warns and protects us. Learn to respond to this signal of the body in a different way. Find another strategy to reduce the excessive feeling of emotions. For this, it is possible to use anti-anxiety drugs in the form of isolated pharmacotherapy. But they have a temporary effect, and their side effect, for some this effect is ironically overeating. Another option is a psychotherapeutic approach, to change one's attitude to external and internal problems. In my opinion, it is deeper and more true. But it will take months or even years for psychotherapy to achieve its effect. And often the level of emotional pain is so strong that without medication the work becomes too painful and often impossible. Combining these approaches in a complex of psychotherapy and anti-anxiety sedatives is the most effective option, both in terms of the speed of achieving the effect and for safety reasons for the patient.